Mater Hospital, we're inspired to ensure that our patients feel involved, informed and safe in regards to their care.
In the orthopaedic team, our focus is on ensuring patients progress appropriately and safely in their recovery after surgery. Falls prevention is a major aspect of this.
A recent Monash University study of the New South Wales Clinical Excellence Commission highlighted the following.
86% of hospital falls occur either in the patient's bedrooms or their bathroom areas.
Approximately 70% of falls are unwitnessed.
Approximately 40% of falls happen at night.
Most falls happens when patients getting in and out of bed, going to the toilet or overreaching for the personal items.
At the Mater, all patients complete a fall screen with a nurse within 24 hours of their admission each day or as their condition changes. As an occupational therapist, I then see patients who are deemed at risk of having a fall or who have had a fall and complete a falls assessment and provide further interventions.
Following our review of falls in orthopaedic ward, we found the following trends.
Patients were not using appropriate walking aids or calling for assistance.
And many were unwitnessed.
Impulsive behaviours or rushing, such as getting up too quickly, trying to get to the bathroom or picking something up from the floor.
60% of patients in a survey believed they weren't at risk of falls.
Falls were occurring amongst patients who were deemed to be low risk or independent.
This is despite the education from nursing and allied health staff regarding calling for assistance or using walking aids.
In response to this, here at the Mater, we've implemented the traffic light program.
The traffic light is a quick, clear, simple tool that is used to help patients understand what level of assistance they need and what is the appropriate mobility aid for them to walk with.
Each acute orthopaedics patient will be assessed by a physiotherapist where their mobility needs or limitations are identified.
Patients who have been allocated a red tag on their gait aid have been deemed as needing the assistance of at least one staff member when mobilising at all times.
This can either be to provide supervision or for hands-on assistance.
Patients who have been allocated an orange tag have been identified as being safe to mobilise independently, but to proceed with care. This involves taking time to steady themselves when first sitting on the edge of the bed, getting their bearings and making sure that they're not feeling dizzy, lightheaded, nauseous, and also being aware of their surroundings before proceeding. Patients who have been allocated a green tag are independent. These patients are deemed appropriate to walk around safely. We give these patients education to ensure that they're aware that they have had surgery, but these patients are generally either ready to go home or are ready for rehab.
Since the implementation of this program, it's resulted in a roughly 70% decrease in our rate of falls. This has allowed us to open up the lines of conversation with our patients and their families with a multidisciplinary team.
Garden, I think this new falls initiative is fantastic because the older we get, the better we work. We all stumble every day and trip, but for older patients, it can be a real problem.
And please, whatever you do, we want to keep you safe. Call and don't fall.